Today we begin part 2 of the lymphatic immune system conditions. We will be covering fever, HIV/AIDS, ankylosing spondylitis, Crohn's, lupus, multiple sclerosis, psoriasis, rheumatoid arthritis, scleroderma, and ulcerative colitis. So let's dive right in. Our first condition is fever. Of course, that's an abnormally high temperature. Core temperature is 101 degrees Fahrenheit or higher. This is otherwise known as pyrexia. It's often due to infection. Less common, it is due to a brain injury or tissue damage. But just remember, if your client comes with a high fever, massage is definitely a no-go. Steps in developing a fever: there is infection with microorganism. WBCs find and destroy invaders. Other WBCs secrete pro-inflammatory cytokines, which stimulate hypothalamus to reset our internal thermostat higher. Muscular and glandular responses raise core temperature. While someone is recovering from a high fever, it is actually a wonderful thing to do a lymphatic massage. There are 3 phases with fever. The chill phase, which are the muscular contractions, which leads to shivering. There's the crisis phase, increased temperature is maintained. And the flush phase, where the fever breaks, temperature falls with sweating, and there is dilation. A moderate fever is actually a good teammate. It speeds up metabolism, it boosts white blood cell activity, and limits iron availability to bacteria. It's the body's natural disinfecting cycle. So teach clients that not all fevers are bad. Support recovery with mindfulness or breath work when they're well enough to do so. Helping them rebuild calm after the storm is definitely what you want to do. A fever becomes dangerous when temperatures over 104 degrees Fahrenheit. That can cause dehydration, acidosis, or even brain injury. Above 112 degrees Fahrenheit is usually fatal. The key takeaway here is respect the body's limits. Never try to sweat out a fever with sauna or hot stone sessions. Clients recovering from hyperpyrexia need hydration, not heat. When someone has a fever, they present with high body temperature, also chills, flushing, headache, muscle and joint pain, and an overall feeling of general unwell. Common medications for treating a fever are acetaminophen, ibuprofen, or aspirin, but remember, never aspirin for children. Treatment timing varies, so the goal is comfort and preventing dehydration, not instantly killing the fever. Be mindful if a patient takes these medications before a session. Heat perceptions and inflammation clues can be blunted, so always ask about recent meds for sure. Massage during a fever is contraindicated. The immune and cardiovascular systems are already taxed, and if you risk exposure as a practitioner, then that's never a good thing. Once the infection is resolved, gentle massage helps restore circulation and calm. So just remember to use this as a teaching moment with clients that sometimes the best therapy you can give is just to rest. Now let's move on to HIV/AIDS. The cause here is HIV, which is the human immunodeficiency virus. HIV attacks agents of the immune system, and then that leads on to the disease, which is AIDS, and that is acquired immune deficiency syndrome. Worldwide, over 36.7 million people are HIV positive. Moving on to the U.S., 1.1 million are HIV positive, with 15% not even knowing that they have it. HIV enters the body via blood, semen, vaginal secretion, and even breast milk. Viruses target cells with the CD4 molecule on cell membrane CD4 plus cells. monocytes, macrophages, T cells, blood stem cells, fibroblasts, and others, where white blood cells carry virus to lymph nodes and other locations. HIV is a retrovirus, meaning it stores genetic code as RNA and must convert it to DNA. This makes the virus tricky. Its constant mutations are why we don't have a true cure yet. It can lie dormant for years in lymph nodes or macrophages before reemerging. So ask about energy levels and adjust the session length, temperature, and pressure to what feels replenishing. And fatigue is a signal here, so make sure you're listening to it. This is also a virus where once infected cells die, it just releases more of the virus. HIV progresses in several stages. The new infection is where the virus multiplies quietly, and blood tests may still be negative at this point. And the acute infection is where you have flu-like symptoms, fever, weight loss, and night sweats. After the acute phase, there's the asymptomatic stage. The body and the virus reach a fragile balance that can last for years with no symptoms and no opportunistic diseases. Then we have AIDS, where your T cell count can be lower than 200. Opportunistic infections appear. Work only when the client feels well. If they mention opportunistic infections at all, just postpone until cleared by their provider. HIV does not survive long outside a host. It can't be caught from a table sheet or a lotion bottle. This is important to remember because unfounded fears harm both practitioner and client. So the sanitation procedures that you already do, such as fresh linens, clean hands, and disinfected surfaces, are already enough. Confidence in your safety habits keep the session comfortable for everyone. HIV has two main strands so far. There's HIV-1, which is the most common worldwide and responsible for most U.S. cases. And then there's HIV-2, mostly seen in West Africa. It's a slower progression and may evade some tests. Both behave similarly for our purposes. Treatment protocols differ slightly, but the therapeutic approach, which is care, respect, and awareness, will always be the same. Complications for AIDS opens the door to indicator diseases such as pneumocystis pneumonia, Kaposi sarcoma, non-Hodgkin's lymphoma, and cytomegalovirus. Each infection or cancer represents an overwhelmed immune system. If there are visible lesions, avoid direct contact. Otherwise, light touch can reduce anxiety, pain, and isolation, and always prioritize comfort and dignity. When it comes to prevention, two acronyms worth mentioning are PrEP, which is pre-exposure prophylaxis, and PEP, which stands for post-exposure protocol. Both are medication plans that greatly reduce infection risk, so education equals empowerment here. As wellness professionals, we can model non-judgmental health conversations and never assume, always support. Treatment today uses ART, antiretroviral therapy. The goal here is to suppress viral replication and preserve T cell function. Side effects include nausea, neuropathy, and fatigue, and can influence massage choices. Ask which meds they're on because some cause fragile skin or easy bruising, and opt for soothing techniques like effleurage or energy balancing rather than aggressive work. Massage can be deeply beneficial for clients with HIV or AIDS. Reduced anxiety, better sleep, and improved mood are all documented effects. But every session should be guided by current health status. If asymptomatic, massage is safe. If immunocompromised, use lighter pressure and shorter sessions. If active infection, postpone altogether. Gentle, present moment touch can restore body confidence and emotional well-being. Always lead with compassion. Your hands may be the safest place a client feels all week. Ankylosing spondylitis is spinal inflammation with stiff joints, progressive inflammatory arthritis of the spine, also known as rheumatoid spondylitis. It is greater in men than women with a 3-to-1 ratio. It may be underdiagnosed in women, and it is mostly found between the ages of 20 to 40 years old. AS is part of the seronegative spondyloarthropathies, which is a fancy way of saying autoimmune spinal inflammations without rheumatoid factor in the blood. The immune system mistakenly attacks connective tissue at the attachment points of tendons and ligaments. This inflammation slowly leads to new bone growth and eventual fusion. The trigger, possibly a gut bacteria imbalance or another environmental factor. When clients have autoimmune conditions, check how they're feeling that day. Some mornings, light touch only is perfect. Other times, they can handle full relaxation work. Always let them set the pace. Inflammation often begins at the sacroiliac joint, then creeps upward through the spine. As vertebrae fuse, the natural lumbar curve flattens, and the thoracic spine may be rounded forward. In severe cases, the neck can fuse in flexion, leaving the client looking permanently bowed forward. Massage can help maintain mobility in unaffected areas and ease the muscle tension that builds from postural strain. Think of yourself as helping the client breathe space into their spine, one session at a time. Symptoms usually start with chronic low back pain and stiffness, especially in the morning or after rest. It often improves with movement, which sets it apart from typical back pain. During flares, clients may experience fatigue, low-grade fever, and even eye inflammation. Pain can radiate to hips, shoulders, and ribs, and avoid deep or rigorous pressure during active inflammation. It can worsen pain, and gentle, rhythmic massage supports parasympathetic activation and relieves muscle guarding. There is a high risk of osteoporosis and fracture here. Nerve pressure, loss of lung function, and inflammation in other tissues such as eyes, heart, aorta, prostate, GI tract, and kidneys. Treatment focuses on controlling inflammation and maintaining posture. Common therapies include NSAIDs for pain and stiffness, DMARDs, biologic agents like TNF inhibitors, exercise and physical therapy to prevent stiffness. Ask if they're on biologics or steroids because both can thin the skin or increase bruising risk. Adjust your pressure accordingly. Massage during flare-ups can increase pain and inflammation. Wait until the flare subsides. However, during remission, it can be wonderful for reducing stiffness, improving circulation, and promoting body awareness. If a client's spine is fused, avoid prone work unless they can comfortably lie face down. Side lying or semi-reclined positions are often best. Recent case reports suggest mixed outcomes with massage. Some found improved function, others documented injury from aggressive techniques. The moral of the story: gentle, skilled, informed touch only. Always prioritize communication, asking, does this feel supportive, rather than does this hurt? Subtle shifts in wording foster trust and body mindfulness. Crohn's disease is a progressive inflammatory autoimmune disease that may affect other tissues as well. It is part of inflammatory bowel disease with ulcerative colitis. Most people are 13 to 30 or 60 to 70. Most often affects Caucasians, Ashkenazi Jews more than others, and 1.6 million in the U.S. have IBD. Crohn's can appear anywhere from the mouth to the anus, but it often targets the ileum, which is the last part of the small intestine. When a client mentions Crohn's, think gentle and supportive. Abdominal work can be soothing and remission, but never during a flare-up. Comfort, empathy, and warmth are your top tools here. Crohn's disease is where overactive T cells cause an inflammatory response and damage to healthy cells. It is in disconnected patches where uninvolved areas, or otherwise known as skipped patches. Crohn's disease is a perfect storm of complications. We have ulcers, scarring, stenosis, bowel obstruction, fistulas, anemia, gallstones, kidney stones, stunted growth to peritonitis, urinary tract infection, cirrhosis, jaundice, and osteoporosis. During flares, clients may report cramping and abdominal pain, bloating and gas, bloody diarrhea, weight loss and fatigue, and fever. Between flares, symptoms often subside and the client may feel relatively normal. Check in before each session, and today may be okay, but maybe tomorrow it might be a flare. Clients often appreciate side lying positions to reduce pressure on the abdomen. Treatment and medications begin with diet, meaning avoid triggers, liquid diet if necessary, anti-inflammatories, antibiotics if necessary, possible surgeries, steroids, and immune-modifying drugs. Massage during a flare is contraindicated. It can worsen pain and strain. However, during remission, massage can reduce stress and anxiety, improve sleep, support digestion through relaxation. So encourage parasympathetic rest and digest balance. Think comfort care, not clinical intervention. Your goal here is calm, not cure. There is little research specifically for Crohn's disease, but patients tend to be enthusiastic about massage therapy, so be informed of the client's treatments, including surgery and medications. Gentle work here with the abdomen can be supportive and helpful. Lupus is an autoimmune attack on various tissues, ranging from very mild or very severe. It can affect the heart, the lungs, kidneys, and brain. Women are more susceptible than men with a 9-to-1 ratio, mostly between ages 15 to 44 years old. People of color have higher incidence and earlier onset and a more severe complication compared to Caucasians. Lupus involves an overactive immune response that targets healthy tissue. Antibodies, normally our protectors, bind to cells and blood vessels and organs, causing inflammation and damage. The triggers are often a mix of genetic predisposition, hormonal shifts, and environmental factors like UV exposure or infection. This condition flares easily under stress, fatigue, or sunlight. Create calm and dim lighting in your treatment room. Gentle, nurturing massage can help regulate stress and ease soreness. Types of lupus include drug-induced lupus, neonatal lupus, cutaneous lupus erythematosus, systemic lupus erythematosus, and mixed connective tissue disease. You'll see here in the pictures that this is the common butterfly rash, ranging from very mild to severe. The first two kinds of lupus that we'll discuss are drug-induced lupus and neonatal lupus. Drug-induced is related to prescribed medications, and symptoms will resolve when the medication is discontinued. Neonatal lupus is when a mother with lupus transfers antibodies to a newborn. It presents with skin rash, liver problems for a few weeks, but no long-lasting consequences. Cutaneous lupus erythematosus is a chronic skin disease where you have scaly patches, sharp margins that are not itchy, discoid rash, and that malar rash over the cheeks and nose. Some with CLE develop SLE. Systemic lupus erythematosus, or SLE, is a full body storm. It can cause arthritis, kidney inflammation, neurological symptoms, heart inflammation, and vascular issues. It's unpredictable. Clients may go from fine to flaring within days. Always check how they're feeling today, adjust the plan accordingly. During flares, gentle holding energy work or even guided breath sessions may be more appropriate than traditional massage. This is where it's really good to have those different modalities under your belt so that you can adjust to whatever the client needs. Sometimes lupus overlaps with other autoimmune diseases like Scleroderma, rheumatoid arthritis, or polymyositis. This is called mixed connective tissue disease, and the combination can amplify fatigue and stiffness. Combination conditions require combination care. Shorter sessions, more communications, and plenty of warmth. Think restorative and not corrective. Lupus can affect several systems, including the integumentary, musculoskeletal, nervous, cardiovascular, digestive, respiratory, urinary, and reproductive systems. Skin-related signs include malar or discoid rash, photosensitivity, mouth ulcers, hair loss, and so on. A soft touch and neutral environment are key here. If you do massages outside or considering it, just remember sunlight triggers flares and consider soft indoor lighting or candle-like ambiance in your spa room. Lupus in the musculoskeletal system is painful joints, hands, knees, usually not spine, and nonspecific muscle pain. Moving on to the nervous system, you have headaches, psychosis, fever, seizures, stroke, and peripheral neuropathy. Cardiovascular signs include vasculitis, atherosclerosis, and risk of heart attack or blood clots. Digestive symptoms can include hepatitis, pancreatitis, or peritonitis. Avoid deep abdominal or circulatory work if the client has clotting disorders or vascular inflammation. Gentle rhythmic massage supports relaxation without strain. Now we'll cover respiratory, urinary, and reproductive. Respiratory, pleurisy, shortness of breath or lung inflammation. Urinary, kidney inflammation. Reproductive, increased risk of miscarriage due to clotting issues. Avoid prone positioning if breathing is difficult. Use side lying or semi-reclined setups. Encourage mindfulness and breath pacing. Diagnosis requires a combination of symptoms and blood markers. The American College of Rheumatology looks for at least 4 of 11 criteria, such as rash, arthritis, pleuritis, renal disorder, or positive anti-nuclear antibodies, or ANAs. Clients often reach diagnosis after years of being dismissed or misdiagnosed. A listening ear and affirming environment are just as healing as the massage itself. Treatment aims to reduce inflammation, prevent flares, and protect organs. Common medications include NSAIDs and steroids, antimalarials, immunosuppressants, and vitamin D supplements. Be cautious with clients on immunosuppressants. They're more susceptible to infection. Sanitation and communication are everything. Massage can reduce stress, stiffness, and pain between flares, but during active inflammation, touch may feel like too much. Timing and trust are key. Always prioritize how your client feels in the moment. Even holding their hands or a simple head and neck massage can be profoundly comforting. Multiple sclerosis, otherwise referred to as MS, is an autoimmune disorder where the immune system attacks the myelin sheath, the protective covering around nerve fibers in the central nervous system. Think of myelin like the insulation around electrical wires. When it's damaged, the signals short circuit. There are roughly 400,000 people in the U.S. and 2.1 million worldwide living with MS. It primarily affects women 2 to 3 times more than men, usually diagnosed between the ages of 20 and 50. Sclerosis equals hardened scar or plaque. T cells, B cells attach and destroy myelin in the central nervous system, leaving patchy areas. Oligodendrocytes attempt to repair, but ultimately they fail. Myelin is replaced with scar tissue plaques. The exact cause of MS isn't clear, but triggers may include viral infections such as Epstein-Barr, vitamin D deficiency because less sunlight exposure equals higher rates, and genetic predisposition, environmental toxins. Encourage clients to maintain balance and rest. Fatigue is real and unpredictable, and massage should leave them feeling more energized, not drained. There are several types of MS. each with its own rhythm and flare and remission. Clinically isolated syndrome, relapsing remitting MS, primary progressive MS, secondary progressive MS, and malignant MS. Know which type your client has. A remitting relapsing pattern may mean some days they move easily and others not at all. With CIS, an episode can last for 24 hours or longer, and damage is seen with an MRI. RRMS accounts for about 85% of cases. During remission, nerve function may return temporarily, but cumulative damage leads to slower and less complete recovery over time. Massage during remission can relieve pain, improve mood, and enhance sleep quality. During flares, even light touch may feel overstimulating. Focus on stillness and gentle presence. Primary progressive MS progresses slowly but steadily. No peaks, no valleys. Secondary progressive MS evolves over years of relapses with less recovery in between. Malignant MS is rare and aggressive, causing rapid loss of function. If mobility is affected, adapt your setup. Side lying, reclined, or in a wheelchair, a client-centered mindset is more important than a textbook position. MS is called the great imitator because symptoms vary so widely. Common ones include muscle weakness and fatigue, numbness or tingling, spasms and stiffness, balance and coordination problems, blurred vision, digestive issues and constipation. Avoid extreme temperature changes. Heat can worsen symptoms. Keep the room cool and pressure steady. Offer extra time for transitions on and off the table. Treatment goals are to slow disease progression and manage symptoms and maintain function. DMAMs reduce relapses, steroids help reduce flares, antidepressants may help support mood stability, and physical therapy and stress management remain essential. Coordinate with the healthcare provider if your client's mobility or medication has changed. Gentle, rhythmic techniques help with muscle tone and circulation. Massage can't cure MS, but it can reduce spasticity and muscle pain, improve sleep quality, ease anxiety and depression, encourage positive body awareness. Overstimulation, overheating, or fatigue if pressure or pace is too intense. Keep touch slow and predictable. Avoid abrupt temperature shifts, hot stones, or strong percussive work. Finish with gentle grounding touch to help them feel stable and safe. Psoriasis is a chronic skin condition where cells are replaced every 3 to 4 days. This causes itchy scaly plaques to accumulate rapidly, and it's usually classified as autoimmune. It affects men and women equally. It's most common among Northern European, Scandinavian ancestry, but rare among Native American, Japanese, and Inuits. The immune system, particularly T cells, become hyperactive and signals skin cells to reproduce too quickly. This causes inflammation in the dermis and rapid buildup in the epidermis. Triggers include emotional stress, cold weather, skin injury, smoking, alcohol use, or certain medications. Clients may feel embarrassed about their skin, so approach every area with respect and confidence. There are several types of psoriasis, each with their own unique characteristics. We have plaque, guttate, pustular, inverse, erythrodermic, and nail psoriasis. In these pictures, we're looking at plaque psoriasis, which is about 80% of all cases. Small to large lesions, symmetrical in distribution. They are slightly raised, itchy, flaking, and silvery scale. May progress to become more severe. Just be mindful not to use an exfoliation technique on plaque psoriasis. It will cause it to be worse. Guttate psoriasis often follows bacterial or viral infection like strep throat. It looks like red raindrops sprinkled across the trunk and limbs. It often resolves on its own, but can recur with stress or illness. Avoid sessions during active infection Once healed, focus on immune balancing and stress reducing techniques. Pustular psoriasis presents as small, sterile blisters, most often on palms and soles. It's associated with kidney, liver, and lung problems. Inverse psoriasis usually presents at skin folds. It's otherwise known as flexural psoriasis. The skin is red, shiny, feels raw, and sore. You're vulnerable to secondary yeast and fungal infection if you have this. Erythrodermic psoriasis can cover nearly the entire body and cause dangerous fluid loss and infection. This is a medical emergency, not a massage situation. Nail psoriasis presents in the finger and toenails. There is pitting, splitting, and discoloration. Can be freestanding or with another form, and it indicates risk of psoriatic arthritis. Psoriasis is cyclical, flare and remission, itchy, scaly plaques, thickened nails, and sometimes joint pain. About 10 to 30% of those with psoriasis develop psoriatic arthritis, which resembles rheumatoid arthritis. Treatment focuses on slowing cell growth and reducing inflammation. Topical meds, vitamin D creams, corticosteroids, or tar-based ointments. Phototherapy, controlled UV light exposure, systemic meds, which are immunosuppressants or biologics. If the client uses topical steroids, note that their skin may be thinner or more sensitive. Avoid heat treatments if they're on systemic meds that alter immune response. Massage can reduce stress and anxiety, two major psoriasis triggers. It can also improve circulation and self-image. Avoid working over broken skin or lesions and never assume discomfort. Ask permission first. If using lotion here, remember to use hypoallergenic lotion and consider working through the sheet if the skin is damaged. Rheumatoid arthritis is an autoimmune disease that primarily targets the synovial membranes, the lining of our joints. The immune system essentially misfires and launches a long-term inflammatory attack on these tissues, leading to pain, swelling, and potentially deformity over time. In the U.S., around 3.1 million people live with RA, and it affects women about 3 times more than men. Smoking, caffeine use, and certain environmental exposures can increase risks. The immune system targets the synovial lining, causing it to thicken and overproduce fluid. The buildup causes swelling and pain. The longer the inflammation lasts, the more it erodes cartilage, bone, tendons, and ligaments. T cells, B cells, and pro-inflammatory cytokines are all involved. This is inflammation on overdrive. Swelling equals pause. During flares, avoid deep tissue, stretching, or any work that might aggravate sensitive joints. Instead, use gentle compression, warmth, and slow rhythmic movements. Though it starts in the joints, RA can affect more than just the hands and knees. It can also impact the eyes, the lungs, the heart, the skin, even the neck, especially between the first 2 cervical vertebrae, C1 and C2. Neck involvement can be dangerous if unstable. Avoid traction or strong neck movement unless the joints have been cleared by a healthcare professional. Another type of rheumatoid arthritis is juvenile rheumatoid arthritis, aka juvenile idiopathic arthritis. RA is unpredictable. Symptoms come and go. Early warning signs may include fatigue and malaise, swollen red warm joints, morning stiffness that lasts over an hour, nodules or lumps near the joints, and pain that eases slightly with gentle movement. RA increases the risk of osteoporosis due to both the disease and medication used to treat it. Over time, clients may develop joint deformities, tendon rupture, and joint instability, especially in the cervical spine. Treatment goals are to reduce inflammation, preserve function, and slow joint damage. Common medications include NSAIDs, corticosteroids, DMARDs, biologic agents, analgesics for pain. Be cautious with clients on steroids or DMARDs because they can bruise easily and they have a compromised immunity. Hygiene and moderate pressure are key. Massage can be a godsend between flares, helping with pain, muscle tension, and mood. During flares, however, deep or vigorous work can cause harm. Studies show that moderate pressure massage may improve grip strength and reduce pain in people with RA, more effective than light touch. But always let the client lead the way. Before working, ask, "How are your joints today?" That one question shows you care and sets the tone for safety. Modify pressure moment to moment. Diving into Scleroderma, otherwise known as hard skin, it is an autoimmune disease that causes collagen buildup in the small blood vessels. It can affect other tissue as well, and about 500,000 cases are present in the U.S. Women are greater than men here with a 4-to-1 ratio. The immune system attacks the lining of arterioles and capillaries, triggering inflammation that activates fibroblasts. These cells produce too much collagen, which then accumulates like scar tissue. As swelling subsides, hardened tissue remains, restricting motion and circulation. Possible triggers include viral infections, environmental toxins, and abnormal immune responses. Maintain a warm environment because cold triggers vascular constriction and pain. Scleroderma presents with three main categories: local scleroderma, systemic scleroderma, and environmentally induced scleroderma, with local and systemic having different subgroups. Local scleroderma affects the skin only, and there are two main subtypes, morphea and linear scleroderma. Morphea are oval patches on the trunk, face, and extremities, pale in the center, purplish on edges, and can be local or widespread. Linear scleroderma are discolored lines on leg, arm, and forehead, leaving a sword fight scar. Systemic scleroderma presents three different types: limited, diffuse, and sign. Limited or crest syndrome is slow onset, affects face, hands, and forearms. Diffuse is a rapid progression and may affect internal organs such as heart, lungs, and kidneys. Sign is an internal organ involvement without visible skin changes. Environmentally induced scleroderma is specifically related to toxic exposure such as vinyl chlorides, pesticides, and epoxy resins. Revisiting systemic scleroderma, we have here crest syndrome with the letters that stand for each of the conditions that go along with it. Typical symptoms include tight, hard, shiny skin, pigmentation changes, hair loss, joint stiffness, and muscle weakness, Raynaud's phenomenon. Avoid aggressive stretching or friction. Focus on warm, gentle mobilization. Because collagen buildup isn't limited to the skin, complications may include microstomia, lung fibrosis, heart complications, kidney disease, and nerve compression. There's no cure, but treatment focuses on managing symptoms and preventing complications. Immunosuppressants and steroids, calcium channel blockers, ACE inhibitors, proton pump inhibitors, and physical and occupational therapy. Massage can support circulation, comfort, and emotional well-being, but must be adapted. The greatest risk is overworking delicate tissue or overstimulating fragile vessels. Start slow. A hand or arm massage alone might be enough. Remember, in scleroderma, less pressure equals more benefit. Research suggests that lymphatic drainage and gentle hand massage can improve function in people with scleroderma. Consistency matters. Regular brief sessions may do more good than long ones. Living with tight, painful skin can be isolating. Clients may have anxiety about being touched. Approach with compassion and consent. Tell them exactly what you're doing and why. Your calm, confident energy is medicine, so let your tone and pace reassure the client that they're in safe hands with you. Now we are on our final condition of this presentation, ulcerative colitis, a condition that inflames from the inside out, reminding us that every system in the body speaks to the others. Ulcerative colitis, otherwise known as UC, is a chronic inflammatory bowel disease that specifically affects the colon and rectum. Unlike Crohn's, which can occur anywhere in the GI tract, UC stays in the large intestine, creating continuous areas of inflammation and ulceration along the inner lining. It's most common between ages 15 to 30, with a smaller second peak around 50 to 70. Genetics, immune dysfunction, and environmental factors all play a role. Clients may deal with bloating, abdominal tenderness, and unpredictable symptoms. Ask how they're feeling that day and avoid abdominal work during flares. Keep sessions calm, gentle, and grounding. UC begins with the immune system and mistakes normal gut bacteria for invaders, attacking the mucosal lining of the colon. This results in ulcers, bleeding, and chronic inflammation. Over time, scarring and loss of elasticity can affect digestion and absorption. Inflammation and stress are best friends. They feed off of each other. Relaxation massage can help calm the nervous system and indirectly reduce inflammatory flare frequently. UC can be classified by how much of the colon it affects. Ulcerative proctitis is the rectum only. Proctosigmoiditis is the rectum and sigmoid colon. Left side colitis is up to the splenic flexure. Pancolitis is the entire colon, where fulminant colitis can lead to toxic megacolon. Common symptoms include diarrhea, often with blood or mucus, urgency or frequency, abdominal cramping and pain, weight loss, fever, and fatigue. Chronic inflammation can lead to colon cancer, perforation, dehydration, anemia, and toxic megacolon. If your client reports sudden severe abdominal pain, fever, or bloody diarrhea, postpone the session and recommend immediate medical evaluation. Treatment aims to reduce inflammation and promote remission. Anti-inflammatories, corticosteroids, immunosuppressants, or biologic therapies, or even surgery if unresponsive to medication. Risks are abdominal pressure during flare-ups, dehydration or dizziness during long sessions. Keep touch rhythmic and predictable, and encourage clients to communicate freely about comfort levels throughout the session. Benefits include calming the nervous system, reducing anxiety and muscular tension, and promotes restful sleep. UC isn't just physical, it is affected self-esteem, energy, and social life. Clients may feel subconscious or fear embarrassment. Compassionate listening and gentle care can transform their experience. Create a judgment-free environment. Integrative support often includes acupuncture, yoga or gentle stretching, mindfulness, and guided relaxation, along with nutritional counseling. Encourage clients to combine these with consistent massage care for long-term balance. The mind-body connection is a major player in chronic inflammation. You want to make sure that you're also checking in with clients that have colostomy bags and how to make them more comfortable. This means we have a responsibility to be knowledgeable. So, across every disorder that we've covered, whether it's autoimmune, inflammatory, or degenerative, one message rings true. The body is always trying to heal, and as therapists, we meet the body where it is, not where we wish it were. Our goal isn't to fix it, it's to support. Every stroke, breath, and word of compassion helps clients reconnect with their inner resilience. Remember, everybody tells a story. Some stories whisper and some shout, but all deserve to be heard with gentleness and respect. The true art of body work is listening with your hands, your intuition, and your heart.